Welcome to part one of the Pōhiri element, planning and relationship building to engage effectively with Māori communities. This stage of the process is critical because this is where the foundation is laid for respectful engagement with Māori communities. Building a meaningful relationship with a community depends on getting things right from the beginning. This video focuses on information gathering and first contact with the community.
Like any new relationship, you need to know about the community you want to build a relationship with. Information gathering is a way to increase your knowledge of a community's lived realities. Important to know are the disparities and structural barriers that determine poorer sexual and reproductive health outcomes for Māori than for Pākehā New Zealanders. Also important are the community's strengths, their resilience, care for land, the environment, their people and cultural resources. This is an essential part of building your capacity as sexual and reproductive health promoters, as well as your organisation's health literacy. Demographics. Socio-economic status, level of deprivation, disparities, rural, urban location. These give you an insight into the challenges and barriers experienced by a community. Your organisation may already have evaluations and reports relating to the community on file. If so, do you have access to them? If not, your local DHB or PHO may have a Māori health unit. They can be a good source of socio-economic data and demographic information for Māori populations. Consider building a relationship with them too. Find out if your organisation has any history of prior engagement with the community, either positive or negative. This is important to know because it's likely to influence the community's perception of you. This is the time to reflect on your own and your organisation's core values, beliefs and understandings of sexual and reproductive health and of Māori. How similar are they to those of the Māori community, and how do you know? Do you have the necessary skills? Is your organisation a good fit to work with the community, or would it be more appropriate to refer the sexual and reproductive health promotion to another organisation whose values and beliefs are more closely aligned to those of the community?
When planning to make contact with a Māori community for the first time, key considerations are: who's the most appropriate person in your organisation to do that? When is the appropriate time? Who is the most appropriate person or people in the community to make contact with? How do you know? A skilled and experienced person to provide you with support can be a great asset. Is there someone in your organisation or networks that already has a relationship with the community? Someone to guide you through the process of making contact or make contact on your behalf? Who knows or can find out the right person to contact, what's going on in the community, and whether it's a good time to approach them? If you work for a DHB, you could try contacting your local DHB Māori health unit for advice and support. Or, if you work for a GP practice, your primary health organisation may have a Māori advisor. If you work for a non-government organisation, hopefully there is a Māori advisor that can assist. Remember to acknowledge your support person's assistance with a koha. When making contact for the first time, be very clear to yourself and to them that your intention is simply to meet with appropriate community members with a view to begin building a relationship. Nothing more. Be aware of the power dynamics inherent in any process of engagement. In interactions with government agencies, Māori typically find themselves in a position of less power. In the sensitive area of sexual and reproductive health, experienced promoters have the ability to bring about great benefits or do great damage. so tread gently. Building a relationship with the Māori community takes time, maybe longer than you would like. Don't be discouraged, but equally don't be pushy if the time is not right for the community. You could ask when might be a good time in the future to get in touch, and make sure you follow up. Key points to remember. The Pōhiri Elements stage is critical to building respectful relationships with Māori communities. Your organisation's core values and beliefs should fit with those of the community. Information gathering and self-reflection are essential to building your capacity as a sexual and reproductive health promoter, as well as your organisation's health literacy. A skilled and experienced person who is known to the community can provide you with valuable advice and support. Be upfront about your intention, simply to build a relationship. Tread gently and be patient, as building new relationships takes time.